Main pathophysiology of rheumatoid arthritis involves synovial membrane inflammation. Second is hyperplastic synovium. Third is cartilage destruction, and fourth is bone erosion. Synovium is characterized by mixture of bone marrow derived macrophages and specialized fibroblast like synoviocytes. FLS. Synovial cells maintain steady state of joint by secreting hyaluronic acid and lubricin for joint lubrication and function, as well as it is also processing of waste products. A synovial compartment is infiltrated by leukocytes, and the synovial fluid is flooded with pro-inflammatory mediators that interact to produce an inflammatory cascade. This cascade is characterized by interaction of FLS with cells of innate immune system as well as cells of adaptive immune system. The second mechanism is hyperplastic synovium. In rheumatoid arthritis, the dysfunction of FLS leads to hyperplastic synovium. The third mechanism is cartilage destruction. Cartilage acts as a key component of synovial joint, consisting of chondrocyte and dense and highly organized extracellular matrix. It is synthesized by chondrocytes and contain type 2 collagen and glycosaminoglycans. The hyperplastic synovium causes major damage to cartilage in rheumatoid arthritis. The articular cartilage does not have enough regenerative potential by itself. Consequently, under the influence of synovial cytokines, particularly interleukin 1 and 17A and reactive nitrogen species, the cartilage is progressively deprived of chondrocyte and that undergo apoptosis. This results in cartilage degradation, demonstrable as joint space narrowing on the radiography. Bone loss is a pathological hallmark of RA and manifests as a localized periarticular and systemic bone loss. Bone loss is a result of induction of osteoclast and suppression of osteoblast. There are two pathways of bone loss. First is tumor necrosis factor alpha, IL-6, IL-1 beta, IL-17 and other inflammatory cytokines involved in RA exert a pro-osteoclastogenic effects and suppress the bone formation. The second pathway involves mechanisms of autoimmunity, and there are two. First is formation of immune complex and Fc receptor mediated osteoclast differentiation. And second is formation of anti-citrullinated vimentin antibodies against the most citrullinated protein, making osteoclasts the ideal antigenic targets for ACPA.